Hi, welcome to It Takes Guts. I am your host, Stacy. I've been a gastroenterology nurse practitioner for the past 6 years. Prior to that, I was a nurse in the endoscopy department for 15 years. I love GI health. Today, we're talking about anemia, specifically iron deficiency. Anemia in itself just means you have a low blood count, a low hemoglobin and hematocrit. Iron deficiency anemia means that you are low in iron, which is contributing to your anemia. So what would be some of the symptoms? With anemia, if your blood count is low enough, the two biggest symptoms are fatigue, not just, oh, I'm tired after the day, but fatigue, and shortness of breath. You get winded very, very easily with even just easy day-to-day activities, going down the stairs, walking down the street. And those are the two big things. Why would you get sent to see me, your gastroenterology nurse practitioner, if you're iron deficient? Because oftentimes there is a GI source of that iron deficiency and we want to find it and treat it. Sometimes there are other causes of iron deficiency in females who have heavy menstruation or uterine fibroids, or if you've just had a major surgery. Those could also be iron deficiency causers right there. The surgeries, though, that will be just very short term. For a GI source, you might see it and you might not just in your normal day-to-day. Obviously, if you're going to the bathroom and see a large amount of blood in the toilet, well, there is clearly some lower GI bleeding going on. Those are usually self-limiting. You might only see that for a day or once or twice, and that would not normally lead to iron deficiency. You should still get that checked out. But normally with iron deficiency, it's an occult cause, something that you don't see on a regular basis when you're going to the bathroom. You don't see bright red blood. You don't see black tarry stools. Both of those are signs of a GI bleeding of some type, but that's not normally what you see for chronic iron deficiency. Two causes in your GI tract for iron deficiency would be malabsorption or a chronic bleed. Malabsorption occurs in the small intestine, and that would be mostly celiac disease or a gluten allergy, and that can make you iron deficient. The other causes with bleeding could be ulcers in the stomach, inflammation in the stomach or somewhere in the GI tract, like an inflammatory bowel disease or Crohn's disease, a very large hiatal hernia. That's where part of your stomach comes up above the diaphragm. Superficial vessels in the GI tract called arterial venous malformations or AVMs, or something like a tumor or a cancer. So if your doctor sends you over, or your primary care provider sends you to your GI office and they're like, yeah, you have iron deficiency, what are we going to do for you? Normally what we're going to do, if your iron is low, we need to find out why. We're going to do an upper endoscopy and a colonoscopy. Most everybody knows what that colonoscopy is now because it's talked about all the time. But the upper endoscopy is where we give you sedation and we take a little scope with a light on the end, and we go from the mouth down the esophagus into the stomach and the upper portion of the small intestine. We are looking for large hiatal hernias, inflammation in the stomach. We're looking for any of those little superficial vessels, anything like a tumor. And then also we can take little biopsies in that small intestine looking for malabsorption, celiac disease. We can take biopsies in the stomach looking for a bacterial infection called H. pylori that can also contribute to iron deficiency. If you have H. pylori, then we treat it with an antibiotic. If we find that you have a gluten allergy, a true gluten allergy, then you need to stop eating gluten. We get you to a nutritionist to help you with that. And that will treat the iron deficiency usually because we're treating the underlying cause. The colonoscopy, again, like the upper endoscopy, but we're going from the lower end. We take a little scope with a light on the end while you're still asleep, and we look throughout the entire colon or the large intestine. Again, we're looking for those little superficial blood vessels, the arterial venous malformations or the AVMs. We're looking for any tumors or any inflammation that may be slowly oozing. If we find any of those little superficial vessels inside the GI tract, the stomach, and the colon, we can cauterize them or burn them usually at that time. That stops the bleeding. If there is a tumor, obviously we would want to, if it's a bleeding polyp, we can take it out. If it's something that's too large for us to remove during a procedure, we would get you in with a surgeon so they can take that out. So what do we do if we do the upper endoscopy and the colonoscopy, and we cannot find the source of the bleeding even after looking and taking biopsies. The next step would be a capsule endoscopy or a pill cam. This is where you swallow this little capsule that takes thousands of pictures. It has a little camera inside, and it looks throughout the entire GI tract, but specifically the small intestine, because there's still another, 16 to 20 feet of small intestine we cannot really see when we're doing the upper endoscopy and the colonoscopy. This does not treat anything, but it takes pictures. So if we're like, oh, look, you have some of these little superficial vessels throughout the small intestine, we can at least say there is the source of bleeding. Now, how do we treat those? Well, if it's something we see during the procedure with the scopes, we can usually treat it then. If it's something we see on the capsule and we are not really able to get to it with our scopes, we might send you to a university center where they have different things that they could actually treat that with. Some people would need a surgical intervention. That's not as common. Other times, the bleeding is not all the time. It's just intermittent. It's not really severe, so we can replace your iron at that time and just keep you on an iron supplement either indefinitely or occasional iron infusions they can give you through an IV that helps replenish iron fast. But mainly it's going to be replacing your iron and finding your source of iron deficiency or bleeding and treating it. So if it's malabsorption due to celiac disease, you avoid the gluten. If it's a bacterial infection, we treat the bacterial infection. It heals up any inflammation. It's gone. If there's a tumor, surgery, get it out. If it's the little superficial vessels, cauterize them or burn them so they don't bleed, replenish your iron, and keep an eye on your blood count. Most people do very well after this. So that is really it for iron and iron deficiency. If you have any questions, comments, please let me know. Please like and subscribe to the channel. I would love to hear some comments or ideas of some other things you all would like to know about if you're interested. And please remember, I want you to be informed, educated, and remember that you're not alone.